Hi guys, welcome back to Relentless. I recently had the opportunity to sit down with Dr. John Bartemus and talk about a myriad of health issues. And it's kind of hard to keep these interviews to just 10 minutes when there's so much good information, but I hope it's helpful to you. We had many topics that we discussed, but first I wanted to give you his background and encourage you to always make sure you do check on the training that the people that are giving you your health information have. Because you want to make sure they're truly trained, they've taken the time to get the certifications and licensure that is needed to give you the best care possible. So Dr. Bartemus, he is a self-described health CSI agent whose goal is to put together your clinical puzzle. He doesn't look at you as a population study. He looks at you with your symptoms, your history, and how you're presenting with what you have. He is certified in he's a certified functional medicine practitioner. He is board certified in integrative medicine. He's a member of the International Association of Functional Neurology and Rehabilitation. He is a member of North Carolina Integrative Society, member of Paleo Physicians Network, and he owns and operates Functional Medicine Charlotte in Cornelius, North Carolina. So he has a very good lineup of pedigree in this industry, and someone that we should listen to and learn from his vast knowledge of the body. So I hope you enjoy this interview. As always, comment below with any questions and continue on your pursuit to be relentless in finding true health and happiness. Thanks. Thank you so much for joining us today. We are talking to Dr. John Bartemus about some of the things that we use for acute injuries, chronic pain that we may have, and we do use some certain tools. So we just want to get some more insight on how those actually affect our bodies. I work with clients every day that have acute injuries or chronic pain, and some of the things they're taking or getting done just aren't working, and over the long haul cause more problems. So we want to kind of get some more information on muscle relaxers and cortisone shots. It's a very popular thing in the industry. Sometimes it's the first thing that people go toward because they see immediate relief. But Dr. John, can you tell us a little bit more about each of those things and how they can truly affect us, especially long term?
Yeah. So as far as cortisone shots go, they definitely work for a certain population, and most of the time they work on the first shot. But what we tend to see is the more shots you get, they work for a less amount of time. So for example, if you had knee pain and you received a cortisone shot in your knee, that first shot may last for 6 months and give you relief that long. And then you say, well, I got 6 months last time, let's go get another one. Mm-hmm. And the second one may be 3 months or a month. And then the third one may be a week or not at all. Mm-hmm. And so we commonly see chronic pain patients with that story. Right. Okay, so I got great help, and then it's helped less each time. And there's some evidence out there that you don't want to get more than 3 cortisone shots in the same joint or same spot in your entire life, because it can contribute to speeding the degeneration of the given joint. So maybe as an acute rescue type deal, but not as a kind of pain maintenance
right.
tool.
And that's, with my clients, the one thing I always address with them is you can get relief with a lot of these things, mm-hmm. but the overall idea of what I do and what you do is, globally speaking, mm-hmm. and long term, if your body's having a reaction, that's how your body is communicating to you something is wrong.
Right.
So if you just get rid of that communication, it's going to show up in a different way.
Right.
So it's going to show up in a different inflammatory response, or if it was your knee that was hurting and now the brain can't communicate with that part of the knee because it can't feel it,
yeah.
it's going to go to the hip.
Yeah.
So we have to look further into the body of why that reaction was going on. So can you talk a little bit what happens in that scenario with the brain and the nervous system of why those things work, mm-hmm. why we feel better, but why it truly doesn't help us get better?
Yeah, so pain is a sensory function. The brain is picking up pain through sensory fibers in the joint if we're talking about a knee. Mm-hmm. And so it's the example of your kid falls down, right, and skins her knee, and you run over and you rub the knee and you say, "It's okay, Susie, you'll feel better soon." And you don't know what you're doing, but intuitively you're helping reduce her pain because you're stimulating what are called mechanoreceptors and proprioceptors around the knee. And those are, to get nerdy for a minute, those are large diameter fibers that travel faster to the brain than pain nerves. So rubbing that knee is outcompeting the pain signals to the brain, so you're making her feel better faster.
Wow.
So that's why if you look at the history of rehab, you'll see, it used to be bed rest and ice. And then as we've learned more, it's no, let's do a physical therapy or some sort of manual therapy where you're strengthening muscles and moving joints, because working the joint is actually activating those large diameter fibers to outcompete pain to the brain. Okay. So if we were to have an injury and go into bed rest, the scar tissue lays down in an unmodeled fashion. It's just like laid down there. And so what you want to do is not rest, but move once you're stable and everything. Start moving so that the scar tissue lays down along lines of stress or functional lines that you're actually going to use in your everyday life. So the movement helps new tissue form along proper lines of stress, helps inhibit pain signals to the brain, and basically helps you recover faster.
Awesome. Can you talk a little bit about what the ingredients are in the anti-inflammatory, the muscle relaxers, and cortisone, like what they can do negatively and the negative effects they can have?
Yeah, so from a physiology standpoint, corticosteroids are cortisol derivatives, basically. So if you think about your adrenal glands produce cortisol, which is one of the most powerful endogenous anti-inflammatories that we produce, right? So the corticosteroid shots are based off our endogenous production of our cortisol. And so if you think about it, acute cortisol is anti-inflammatory, right? But chronic cortisol, that chronic anti-inflammatory response, if you see the side effects with chronic cortisol release, whether it's chronic stress or chronic prednisone use or whatever, they're immune suppressing, right? Because inflammation ultimately is an immune response.
Right.
So if we're using a corticosteroid shot or we're under chronic stress in our life and constantly spitting cortisol, then we can end up at a point where we're suppressing immunity. And now if you happen to get an infection or have decreased immune surveillance because of that, ugly things can happen.
Right.
So it's the idea of the shots is based off something we make inside us.
Right.
It's just focused and localized.
Right. And that's, again, going back to the point of what he does with his knowledge is sees the body globally. So you may have someone take the shots or take a certain thing, and then they end up with another symptom later, but they never pair the two together.
Right.
They never come back and say, oh, well, this has caused this. And that's what you do, is you globally look at the body, and if you've had other things in your past, other surgeries, other diagnoses where you've taken other medications, that may cause things down the road that make your body more unhealthy or more suitable for worse things.
Yeah. And if you don't mind, when we talk about pain, I did a video recently I made a broad video on the 3 categories of pain. So there's the structural biomechanical pain, right? You have trauma or an injury or posture that is off, and over time working that joint, you're breaking it down because of the poor biomechanics. And that poor biomechanics causes inflammation in the joint and wearing of tissue and pain.
Right.
There's lots of people with structural or biomechanical pain. But if you have what you think is one of those complaints, say you have knee pain, and you get the cortisone shots and it helps or it doesn't help, then you may have one of the other 2 categories of pain, which one category is neuropathic pain. So it's actually a dysfunction in the nervous system where the threshold for firing is lower than normal, so it takes less to really set it off. And so there's a concept or a term called allodynia where, something that shouldn't hurts you. So that's a lower threshold, and it hurts if I do that to you, whereas in a normal person that doesn't.
Right.
And then there's a concept called central sensitization where the brain is so fired up that everything hurts, even when the triggering stimulus to the pain is removed. Now you're in this vicious cycle.
Right.
So that's a cortisone shot isn't going to help that.
Right.
That's a neurologic deal that needs to be dealt with. And then the third form is metabolic pain. So if you have a metabolic inflammatory process from, say, an autoimmune disease or an inflammatory disease like ankylosing spondylitis, or you have blood sugar issues or thyroid issues or any sort of metabolic disorder that's driving systemic inflammation, then a cortisone shot locally where your pain isn't going to help.
Right.
And it's not until you address the metabolic dysfunction that you may get relief from your knee pain.
Yes. So I tell my clients, to put it simply.
Yeah, sorry.
No. We need to know this information, but sometimes it's a software problem. Sometimes it's a hardware problem. Hardware meaning dysfunctional movement patterns, sports injury, all that kind of stuff in the local area. Software, internal, mental, emotional, all those things are different and they play out differently. And again, that's why it's so important, if you have anything, is to be with someone who can look at the body as a whole, from top to bottom, inside out, and not zeroed in on that one area of pain. Because we have a friend in the industry, his motto is, stop chasing pain. And the area that it is usually not the problem. So that's the whole goal, is looking at the body globally and seeing how we can better make every system function more healthy, and that way we get better results. So I hope you enjoyed that interview with Dr. Bartemus. We will definitely be having him back for more information on more topics. If we happen to miss a topic that you're interested in or are having an issue with, please always leave a comment below with some situations that you're dealing with, and we will always be happy to have Dr. Bartemus back. Thank you so much. Have a great day.